It is Black Maternal Health Week, and we're raising awareness about the alarming number of Black women who die each and every year in pregnancy. In fact, Black women have the highest maternal mortality rate in the country at nearly 70 deaths per 100,000 live births. Plus, they're 3 times more likely to die from pregnancy-related causes than their white counterparts, according to the CDC.
And even after Black moms give birth, their babies have a higher risk of dying or being born prematurely. Dr. Curry-Winchell joins us now. She's the urgent care medical director at St. Mary's Hospital. Dr. BCW, thanks for being with us. So you actually were just recently in a talk with Vice President Kamala Harris in Las Vegas yesterday, talking about reproductive health. What was the main takeaway from that conversation?
That we have to invest in raising awareness on this topic. When we talk about Black maternal health, there are so many different areas that are a part of this, issue. And I was able to share my personal story as a Black female physician, how I almost died giving birth. And so we have to look at this from many aspects and really produce change, because as you mentioned, these statistics are alarming and they continue to go up.
It's alarming because I think, as Black women, we don't ever escape this reality, right? We all know someone who's had a really troubling birth or experience with this. I mean, what are the warning signs, though, that something actually might be wrong during pregnancy?
So the first piece is, thinking about certain symptoms that happen in your pregnancy, such as swelling in your face, your hands, your feet, headaches, extreme fatigue. And the other thing I always like to share with my patients, trust yourself. Do not doubt. If something doesn't feel right, go out and seek out care, because that's the biggest piece that we have to kind of lean into, that you are your best advocate and you know your body well. So if something isn't right, make sure you go out and seek help.
That's so interesting.
Yeah,
I remember the feet swelling. Like when I left the hospital, I remember the nurses kept saying, hey, I want you to look at. I had no idea that was even like a symptom.
So many changes, especially for first-time moms. We know that this problem exists, and yet many Black women are dying during pregnancy. Talk to us about the factors that go into that and why doctors maybe aren't as aware of their own unconscious bias.
The first piece is, what do you think pain looks like? What do you really think about when you look at pregnant women? And so, unfortunately, for Black women, we are not seen, we are not heard. And so that adds to the problem. And then when you add bias to it as well, and the fact that we have structural racism within our healthcare system, all of those things are adding, widening the gap of inequities and disparities that are affecting Black women, not only during pregnancy, but shortly thereafter.
And given what you just mentioned, I mean, what are some preventative steps that Black women can take to stay healthy?
First, I still start with don't doubt yourself and listen to yourself. And the other piece is, before you even get pregnant, think of really investing in all of the things to have, a high quality pregnancy. And so that part is important. And then when you when you seek out a healthcare provider, make sure you're heard and listened to, because your health should be at the top priority.
Health is wealth. Dr. Curry-Winchell, thank you so much for joining us. We appreciate it.
Thank you, doctor. And stay with us. Much more news ahead. You're watching NBC News Daily.